welcome to my channel. Are you a Black woman seeking to have a medical procedure or treatment abroad? Well, this channel focuses on medical tourism for Black women. So if you're interested in learning more about things like cost, pre and post-surgical care, treatment, medications, therapy, follow-up, and so much more, make sure you subscribe to my channel and hit the notification bell so you're notified when I post a new video. So I'm Dr. Natasha Ramental, also known as the Medical Tourism RN. I'm not a physician, but I am a doctoral trained registered nurse who's worked in the emergency department and post-anesthesia care unit for a number of years. So on my channel, I cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for anything from cosmetic surgery to cancer or fertility treatment in order for Black women to make the most informed decisions about their healthcare to have the best outcomes and experience. So this week, April 11th to the 17th, 2023, marks the 4th annual Black Maternal Health Week. So on April 13th, 2021, just a bit of history, President Biden signed the first ever proclamation marking Black Maternal Health Week. It calls for all Americans to recognize the maternal health crisis and the importance of reducing our unacceptably high rates of Black maternal mortality and morbidity. Now, Black Maternal Health Week is also a time for building awareness, activism, and also deepening the conversation about Black maternal health in the United States. The founders of the National Black Maternal Health Week, the Black Mamas Matter Alliance, or BMMA, and I'll leave a link for them in the description. They're a national network of organizations and leaders from the maternal health, human rights, and reproductive justice fields who believe that every woman deserves access to quality and holistic health care. Now, the theme for this year is, for Black Maternal Health Week, is Our Bodies Belong to Us, Restoring Black Autonomy and Joy. So today I decided we're going to discuss IVF treatment abroad, okay? It's also called fertility tourism. And fertility tourism is the idea of traveling to another country for fertility treatment. So fertility tourism actually falls under the umbrella of medical tourism. What I'll say is, although the US does have high quality healthcare and strict regulations, the cost of treatment and lack of success maybe in one's hometown clinics are causing couples to think outside of the box and to travel abroad for IVF treatment. So what is IVF treatment? In vitro fertilization. That is a specialized treatment within reproductive medicine where an egg is removed from a woman's ovaries and fertilized with sperm in a laboratory. It's a tried and tested method that has helped many couples with fertility issues to have a baby, following a process of weighing up their individual circumstances to find the best place for IVF. Now, generally, IVF is a safe treatment, but as with anything, risks can occur, but they rarely occur, I will say that. And if they do, they are due to side effects to the medication and the conditions of the potential pregnancy. For example, maybe the risk of it being an ectopic pregnancy, where the egg is in the fallopian tube, okay? So to administer IVF, different medications are given to stimulate the ovaries into producing more eggs and helping them to mature so that they can then be collected and then mixed with sperm. Now, the last step is to place that fertilized egg into the womb after a few days. Now, donor eggs and sperm can also be used for the process. So there are two ways that an egg can be fertilized: by the traditional IVF and also by a process called ICSI, which stands for intracytoplasmic sperm injection. So in traditional IVF, you have like 50,000 or more swimming sperm that are placed next to the egg in a laboratory dish. And then the fertilization occurs when one of the sperm enters into the cytoplasm of the egg. With the ICSI process, there's a tiny needle that's used to inject a single sperm into the center of the egg. So with either traditional IVF or the ICSI process, once the fertilization occurs, the fertilized egg, which is then called an embryo, grows in a laboratory for 1 to 5 days before it is transferred to a woman's uterus or the womb, okay? Now, although guidelines vary between countries, doctors administering IVF usually do so after the woman has tried other methods, such as artificial insemination, which is a similar procedure where the sperm is injected into the egg without removing the egg from the ovary, okay? Now, age also plays a key role in IVF eligibility, which is something that even the best countries for IVF limit with excuse me, I'm tongue tied, with legislation. So, though it usually comes down to personal circumstances that come with how the woman's body has actually aged. So, the healthier you are, the better circumstances you have. Other factors determining whether a patient can go through with IVF or not will be determined by the doctor, who may actually suggest alternative treatments. So, think about all of those things and factor that into your own situation. Now, when you're going to select an IVF clinic, there's not a best IVF clinic for everyone. The clinic which is best for someone may not be the best for you. So choosing an IVF clinic can also be a difficult decision as to which clinic may be good for one patient, might not be good for the next. So there's no one size fits all. For one person, they may use criteria like maybe where someone else had successful treatment. And for someone else, it just may be depend on the type of treatment, whether it's egg donation, IVF with your own eggs, or IVF with PGS. PGS stands for pre-implantation genetic screening. You're going to get a lot of acronyms in this video, so just stick with me. But PGS, basically, the goal of PGS is to increase the likelihood that your selected embryo or embryos will lead to a successful, healthy conception for your future family. So PGS testing actually reduces the risk of miscarriage. It decreases the time it takes to become pregnant. And it also lowers the need for transferring multiple embryos, okay? There's also another acronym, or another couple, PGD, pre-implantation genetic diagnosis. That's also now referred to as PGT, pre-implantation testing, okay? But all of these are to ensure that you have a healthy pregnancy, a healthy baby, healthy pregnancy, okay? Now, another factor in selecting the right IVF clinic is obviously positive feedback from patients. So looking at the best reviews, offering an outstanding patient-centered approach, and also performing outstanding treatments in their field, because there's a number of fertility treatments that are out there, not just IVF. And then a great fertility clinic isn't just one that can give you effective treatment. It's one that you're going to want to consider if they have compassionate staff, clear and transparent pricing, seamless administrative processes, and also exceptional emotional support, because you're going to need it. It's a taxing process, okay? So as a patient, you need to know that successful treatment may depend on many factors, including your individual situation. This includes your own diagnosis, your medical background, and your treatment history, okay? So there are many great, well-experienced IVF clinics worldwide, but guess what? They also have patients who do not have successful IVF cycles. So it doesn't mean they are bad clinics. In some circumstances, the treatment might be very difficult, and the prognosis for the patient may not be good. All right. The best IVF clinic will inform you of the likely success of any treatment and whether there is a possibility that you will require more than one IVF cycle. That's what's important. So when looking for fertility treatment abroad, I want you to consider these 6 things in your care. Number 1, cost of treatment. So the average price for one IVF cycle in the United States can range from $15,000 to $30,000, depending on the center, location, but also the patient's individual medication needs. Medications can actually account for up to 35% of those charges. So looking outside of the US certainly can be worth it. Many countries can provide high quality of care at a lower cost, okay? Number 2, I want you to consider native language. What language do they speak in the country you decide to have your IVF treatment in? Are you familiar with that language? We want to make sure that you understand it. And if you don't understand it, does the fertility center or facility have translators or physicians that speak your native language? Okay, that's really important. Number 3, governing bodies. You want to make sure you know who is the regulatory body for fertility clinics in this country, and are they under that regulatory body. This is critical to ensure that there's quality, but also safety for you, okay? Number 4, Flight and hotel and travel costs. This is something that you want to factor in as well, because there's one thing with treatment, but the other thing you have to consider are the costs associated with your accommodations, how long you may have to be there, whether or not you'll have to go back. Some other things like if the first cycle is not successful, sorry about that, guys. If that first cycle is not successful, whether or not you may have to go through it again, which involves another flight, hotel, and travel costs. Okay. Also, local fertility laws. There are many laws and regulations that are in support of those going through IVF of using donors, but you need to do your due diligence because you may not meet the criteria in a particular country. So you need to make sure you understand and know all of the laws before you engage in any type of business about your IVF treatment. And then lastly, number 6, the location of your frozen embryos and eggs. So some countries may have limits on frozen embryos, so you're going to want to make sure that you know that ahead of time. All right, so we are going to get into the top countries for IVF. These are in no particular order, guys. One thing I want to do is give you a disclaimer before I share the countries with you. I want to tell you, I do not recommend or refer any clinicians, clinics, hospitals, nothing like that. Okay, I simply provide you with the information on what countries have to offer. So please, please do not contact me asking me for referrals. You should take the information I'm sharing and do your own research on which country and ultimately which facility and clinician you choose. Okay? All right, so let's get into it because it's a lot. Number 1, Israel. So when you think of advanced medical care, your mind probably doesn't wander to Israel. However, this Middle Eastern country is a top destination for fertility treatments globally. Israel is one of the most medically advanced nations in the world behind the US, and it's at the forefront of medical research, making it a popular choice for individuals and for couples that need reproductive assistance. So women and couples visit the largest hospital in Israel. I'm not going to give the name, you can look it up, but they visit them for fertility treatments like IVF and more. One of the main attractions for fertility tourists include Israel's lower treatment costs and their high quality of care. So fertility treatments can be incredibly expensive, as I mentioned before, especially when it's not covered by insurance. IVF treatment in Israel is on average 50% less than it is in the US. So that is something to consider. Number 2, Greece. So Greece has just 60 clinics in its country, but it is a popular destination due to their low cost and obviously beautiful scenery. But they have low cost IVF there. The country also regulates IVF and related procedures, and it is a part of the European Society of Human Reproduction and Embryology, okay, which is well known. However, that varies by clinic and it is not mandated like in the same way that it is in the US. So if you pick a clinic in Greece, you are going to want to make sure that that particular clinic is a part of that ESHRE, okay, the European Society of Human Reproduction and Embryology. Greek is the main language, and some clinics will have translators that can speak English, especially in clinics that actually cater to fertility tourism. PGT is available, however, it is limited in use. So think about that, and you want to make sure that's part of your process for consideration, okay? Single people can get IVF, but in Greece, gay or lesbian couples are not allowed to have care, all right? 3 embryos can be transferred, and possibly 4 if the woman is older. And then there are no harsh limits on embryo storage. However, if you have frozen embryos, you cannot create more until you use your frozen embryos in Greece. Okay. Now, as far as cost, IVF ranges from $3,500 to $5,000 US in Greece, and the medications can range from $1,000 to $2,000. Okay, so it still makes it more economical, obviously more so than the US. Number 3, Spain. So Spain is actually a very popular destination for IVF treatment. Their national healthcare system is public, but Spain is also known to have clean, modern facilities with physicians who are highly trained and they're specialized. And there are many laws and regulations that are in support of those going through IVF, of using donors, okay? Anyone can be treated regardless of age, marital status, and sexual orientation. And a law is in place that prevents discrimination in the healthcare field. So this is something that obviously is an attraction, which makes Spain one of the top places for IVF treatment. Also, surrogacy is currently not allowed in Spain. And most Spanish clinics have people on staff who speak multiple languages, including English. However, English is often not their native language. As far as cost, IVF cycles in Spain average anywhere from $5,000 to $7,000 per cycle, and the medication ranges from $1,200 to $2,000. Okay. All right, number 4, the Czech Republic. So the Czech Republic actually has approximately 30 clinics throughout the country, and it is well regulated by their governing body. Their governing body is the Czech Society for Assisted Reproduction. Now, as a Czech citizen, women under the age of 39 have 3 chances at IVF that are completely covered by the government, which is a great deal if you're a citizen. However, many travel to the Czech Republic without being citizens, and women can undergo IVF up until 48 years of age in order to deliver by 49. Okay, so that's the age restrictions for them. And obviously, there's no age limit for men. We won't talk about that. And then what are the IVF regulations? Essentially, the predominant language is Czech, so I just want to make sure you guys are aware. A lot of clinics there have translators that help with their international patients. Also, egg donation and sperm donation are allowed, although embryo donation is not allowed. Okay, so keep that in mind. And then as far as cost, it can range from IVF costs can range from $2,500 to $4,000 per cycle, and the medication costs can range from $500 to $1,000 per cycle. Number 5, Denmark. So Denmark is actually home to one of the world's largest sperm banks, and that makes it another attractive destination for fertility treatment. The Danish country's ART, which stands for Assisted Reproductive Technology, their success rates with ART are nothing to laugh at. I mean, while the US actually has a 1.7% of all infants born through ART, Denmark actually has an estimated 8 to 10% conceived through ART. So that is honestly remarkable. In addition to offering high quality care to visitors, in 2007, Denmark passed a law granting access to state funded IVF regardless of a woman's marital status or sexuality. So that's really great. As far as cost, the basic cost for IVF in Denmark can start around 3,500 Danish krone, while IVF with ICSI starts around 4,000 Danish krone. And just to give you perspective, $1 is equivalent to 6.8 Danish krone. Okay, so you can do the math on that. Number 6, Turkey. Turkey is known for their thriving medical tourism in general, but Turkey also draws in a lot of patients as one of the best countries for IVF treatment. There are good clinics that are easily identifiable through their association with the many national and international regulators. The prices are also extremely affordable. Turkey offers some of the world's most competitive rates for high quality advanced IVF procedures. As far as regulation, the Turkish Society of Reproductive Medicine is a substantial organization that regularly hosts congresses to work to advance fertility treatments worldwide. And they actually belong to the International Federation of Fertility Societies. Okay, so that's really good. Additionally, the Turkish government actually closely monitors IVF clinics, and they have legislation in place that guarantees their quality and efficiency. So if you go to Turkey for IVF, you'll benefit from the first class treatment that is low cost, and you can actually feel good about knowing that their regulations are in place for the IVF clinic. Now, if you're considering making the trip, it's worth noting that only married heterosexual couples are eligible. Okay. Also, women up to 35 can only have 1 embryo transferred for the first 2 cycles, and then 2 embryos are permitted for the 3rd cycle, or if you are over the age of 35. Okay. Other things to consider with Turkey: hospitals and clinics in Turkey, I mentioned, they're amazingly advanced, and many of their specialists actually train around the world, and they do belong to international societies and have gained experience over a long period of time. Um, some cons: same-sex couples and single women are not allowed IVF treatment in Turkey. Egg, sperm, and embryo donations are all forbidden, as well as surrogacy. And though the age limit for a woman isn't legally defined, the lack of egg donations means that most clinics restrict it to around 46 years of age. Okay. All right. Next country, number 7, India. So India is known for everything from plastic surgery to IVF. Okay, and they're available in cities like Mumbai, New Delhi, Chennai, Bangalore, and others. Affordable pricing, medical facilities, and then also the fact that they have the largest English-speaking community of doctors outside of the U.S. all make treatment in India attractive. Okay, even when you factor in the travel expenses, the total cost for IVF treatment is still well below the pricing in many cities in the US and Western Europe. So, according to several online sources, the cost of IVF in India varies greatly by city, with an average somewhere between $2,500 to $3,000 for the most basic IVF package. Okay, so what that means, that basic package that does not include monitoring, does not include medications, ICSI, frozen embryo transfers, genetic testing, and other add-on services that are either necessary for everyone, like the medications and the monitoring, or that are necessary for some, like in the case of ICSI. So keep that in mind. Number 8, the US. Okay, so I know we talked about costs being really high in the US, but this is about where you have the best treatment. So they needed to be included on this list. The US has several fertility clinics located on the mainland and even on Hawaii. And they offer cutting edge fertility treatments, including IVF, donor egg IVF or fertility preservation, ICSI, in vitro, and so many more treatment options. Okay. But the US actually boasts high success rates, and many patients travel from other countries to gain access to the advanced care in the US if they can afford it, obviously. Now, the US usually has access to staff that can speak several different languages, and they also have access to translators to assist with any of the necessary translations that are needed. Now, the cost is pretty high, anywhere from $15,000 for one round of IVF upward. However, to make fertility treatment feasible for patients financially, some clinics actually partner with several um, financial service companies to assist patients, or they have other options for financing your treatment, especially if insurance may not cover it. I listed the US again because although the cost of IVF is expensive, it is a country among the best in terms of treatment options. All right, number 9, we are moving to the Caribbean now. Grand Cayman and the Cayman Islands. So Grand Cayman is actually the largest of the Cayman Islands, and it hosts a state-of-the-art fertility clinic that actually opened in January 2019, and is focused on providing IVF and donor egg services with some of the highest success rates in the world. So a majority of their patients actually undergo PGT with single embryo transfer, and this clinic reports a greater than 84% pregnancy rate from elective single embryo transfers. That's a really high rate. So that high pregnancy rate and the use of advanced technology for an affordable price actually placed them on this list. They do speak English in the Cayman Islands. PGT is available, as I mentioned, but more than half of the cycles in the Grand Cayman use PGT, making it a destination for patients who actually desire that technology. Also, there is no restriction on treating single women or same sex couples. And egg donation, embryo donation, and sperm donation are allowed in the Cayman Islands and Grand Cayman. Gestational surrogacy is rarely done, but due to the low cost and proximity, many people from North America travel there, and those patients will actually have embryos created in Grand Cayman and then transferred in their home state or province if it is permitted. So, what's gestational surrogacy? That's basically a process where one person who did not provide the egg that was used in conception carries a fetus through pregnancy and then gives birth to the baby. Okay. Now, women can also undergo IVF or donor egg cycles until 50 years of age, which is actually higher than most other countries. So I think that puts them high on the list in terms of your options, because I have to tell you, as your age increases, your options decrease. Okay. As far as cost, the IVF cost can range from anywhere from a little over $6,700 to about $8,000 per cycle. And egg freezing is also very affordable as well. That's just under $5,000 per cycle. Now, when you're talking about medication costs, the medication costs can range anywhere from $1,500 to $3,500 per cycle. Egg donation is predominantly through frozen eggs, and the frozen eggs are from two US based networks of donor eggs. So that's something that, if that's important to you, you can keep it in mind. All right, number 10, we are going to stay in the Caribbean, Barbados. So, Barbados is, there's only one fertility clinic in Barbados. It's a small country of less than 300,000 people, but this clinic is Joint Commission International certified, and it is the most well regarded established practices in the Caribbean. And it started about 19 years ago. In Barbados, they actually do speak English. PGT is available, but it's less often performed relative to what's called fresh IVF. Now, fresh IVF, that's a cycle when, a, okay, a fresh IVF cycle is when an IVF cycle is completed using eggs and embryos that were never frozen. So after the eggs are retrieved, they are immediately fertilized by semen in a laboratory. Okay, so that's the process that is predominantly used in Barbados. There's no restriction on treating single women or same-sex couples. Egg donation, embryo donation, and sperm donation are allowed. However, gestational surrogacy is not allowed. Okay, and like the Grand Cayman in Barbados, women can undergo IVF up until 50 years of age. As far as cost, IVF costs can range from $5,500 to $7,000 per cycle. Egg freezing is available, but medication costs can range from $1,500 to $3,500 per cycle. Now, egg donation is one of the most cost-effective options in Barbados, and that is because it's between $7,000 to $9,000 a cycle, but they use local donors, so keep that in mind. Now, the clinic offers shared donor cycles as well, and that can help further reduce costs. And what that means is that there are two sets of intended parents or recipients, and they share the eggs that are provided by one donor. So they may choose to share fresh eggs with another intended parent, or they can use frozen eggs from the egg bank. But either way, that shared donor cycle helps further reduce cost. All right, number 11, Brazil. So fertility treatment in Brazil is available in 150 clinics, and those clinics are well regulated, and over 20 of the medical centers in Brazil are actually accredited by the Joint Commission International, which is great. They do offer treatment to same-sex couples and single women. Now, typically it's done at private facilities, and those private facilities include specialist centers for infertility treatment. They usually attract good staff, and they have the latest technology. Brazil has been a major center for medical tourism for cosmetic surgery for many years, hence the term Brazilian butt lift. But procedures that are carried out in dedicated plastic surgery clinics, but Brazil has more recently expanded the availability of other types of medicines, including fertility treatment. So doctors, fertility specialists, and other senior medical staff in Brazil have usually they've trained in the US or somewhere else, and more of them speak English than in the past. We're finding that happens a lot more. Also, the cost of treatments are more highly affordable in comparison to the US and Western Europe, as the value of the real, which is their money, is still low against the US dollar. Now, facilities and clinics offering fertility treatments they have high success rates, and they're actually comparable to some of the best in the world. What you need to know about Brazil is So the infertility clinics are usually registered with a Brazilian government agency, and regulation is at the statute level. And there is also a national licensing body. And in January 2011, Brazil, which you have to keep in mind, a country that has the largest Roman Catholic population in the world, they actually extended availability of IVF and other fertility treatments to lesbian couples, homosexual couples, and single women, which is a huge deal for that society. Now, one of the things that they boast is that their waiting time for IVF treatments is virtually zero. So a couple is advised that they'll need to be at the infertility clinic in Brazil for a period of 14 to 21 days for treatment, and it begins on the day of arrival. Okay. Now, medical tourism agencies work internationally to arrange your travel and your accommodations in Brazil, as well as the treatments with the infertility clinic of your choice. And then in the case of an abandoned or an unsuccessful IVF cycle, most clinics in Brazil actually offer a refund of 50% of the cost. I mean, I have not heard that anywhere else, so that is something to keep in mind. In Brazil, PGD is allowed. Also, IVF surrogacy is allowed. However, the surrogate must be related to the prospective parents, and payment to that person is prohibited. Okay. Number 12, Mexico. So with Mexico, IVF agencies and clinics are actually present in a number of major cities in Mexico, including Puerto Vallarta, Tijuana, Cancun, Guadalajara, Mexico City, and Monterrey, and Mexicali. Okay. But many of these facilities are non-traditional clinics known as medical spas, that actually offer plastic surgery and other cosmetic procedures, or they are part of a large hospital. Okay. But there is one clinic, and it's only one IVF clinic that's actually located in Puerto Vallarta, that is the only lab licensed for what's called microsort. Okay. Now, that's the Gender Selection Technologies Corporation that's responsible for helping intended parents have a baby of their desired gender during ART, assisted reproductive technologies. So they offer various IVF treatments and also frozen embryo transfer. Now, many intended parents are actually turned away from the US clinics for being considered too old, or too challenging of a case involving repetitive IVF failures and recurrent pregnancy loss. So, what I would say, in IVF clinics in Mexico actually hold vast knowledge and expertise in fertility treatment for patients over 40 years of age, which is great because, again, as I said, your options decrease as your age increases. As far as cost, you can actually save anywhere from 70 to 75% when compared with the US and Canada. And given that Mexico is so close in proximity to the US, honestly, that's something that makes it a huge consideration for a number of people. Number 13, Panama. So Panama is well known. They have an IVF clinic in Panama that is the number one choice for IVF abroad in the region. They boast having a US board certified reproductive endocrinologist who will tailor a treatment plan specific to your case. So they're also able to send you prescriptions and orders to take directly to a radiologist or to your OBGYN and your pharmacies, and you would have 24/7 access to your treatment team to ensure seamless communication and clear instructions throughout your journey. Now, IVF is also done at local hospitals, which some are Joint Commission International certified. So you'd have to do your research on which ones are and aren't. As far as cost, it can range from $3,500 to $5,500 for one round of IVF in Panama. All right, number 14, and our last one, Kenya. So with high quality technology and facilities in the region, many patients from East Africa now prefer Kenya for medical purposes because it's nearer to home for the same medical treatment that they seek abroad. Also, Kenya is building more hospitals, and they are developing a framework for medical tourism that actually aims at positioning Kenya as a destination for specialized healthcare services that appeal to both Kenyans and international clients. Now, the country offers quality OBGYN services and much more, but as far as IVF, that is a common medical treatment that many seek in Kenya. Kenya is one of the countries where major tourists seek IVF because of its low cost and its high success rate. And according to research, about 70% of people traveling look for IVF in Kenya. And the Aga Khan University Hospital is one of the leading IVF centers there, where they do 3 to 4 cycles that are carried out each week. As far as cost of IVF treatment, that depends on several factors, such as the type of IVF procedure, the age of the woman, the cause of infertility, and also the clinic chosen for the procedure. But an average cost of IVF in Nairobi, in particular, ranges anywhere from just under $3,000 to about $4,500. And to give you a bit of perspective, one US dollar is equivalent to 134 Kenyan shilling. So your money can actually stretch pretty far. Okay, so those are the 14 countries. I will give an honorable mention slash sort of number 15 as Ukraine. Ukraine was known for IVF treatment, especially at a low cost. They had a high success rate. This was obviously pre-war with Russia, so I did not include them fully on the list, but they got an honorable mention because that's something they were known for. Now, before I end, one thing I want to make sure that you are clear about is pricing. Okay, you must have transparency in all costs that are associated with IVF before you travel. You may have pricing that includes charges for like ultrasounds, anesthetic charges, doctor's fees, and maybe one day in a clinic lasting X number of hours. But the cost of medication, blood tests, counselor's fees, those things are not included. So I want to make sure that you ask about those things, okay? Also ask if there are additional fees for foreigners, right? That makes sense. They may have a different pricing for those who are locals. Also ask if there's additional fees to have a specific gender, okay? And then prospective patients, you have to be really careful to consider the various hidden fees and the cost of travel when you're evaluating all of those options. So it's important that you ensure you get an accurate quote, which includes the entire cost of treatment. And very few clinics actually publish any pricing information online. The vast majority of clinics actually require you to request a quote and give some personal information or schedule a consultation, which is usually free, before providing any pricing information. And honestly, that makes sense because, again, it's an individual situation and it depends on a number of factors that are specific to you as a patient. So, as always, I encourage you to do your own research. Check the accreditations of the hospitals that you're considering, as well as the credentials of the surgeons. And many sites, they post reviews from patients, and you should read them. Expat sites, repat sites, travel sites, they usually have a Q&A page. Post your questions and people will share their experiences. They're happy to do it, but I want to make sure that you are aware of all of these things. Until next time, be well, and don't forget to click the like button, share, and subscribe, and hit the notification bell so that you know when I post the next video. Okay, until next time, bye.